It's Dr. Kirsten Fulong here, and I'm here today to talk to you about antibiotics. I want to talk to you today about their misuse, their overuse, their short-term and their long-term effects on your health, your immune system, and your child's immune system. Now, here's the truth. Even when used appropriately, antibiotics will save your life. And when they're used appropriately, we do get a lot of overuse of them, and we're disrupting our kids' microbiomes, their gut, their behavior, and their nervous systems, and that's where we come in. In this video, I'm going to give you a couple pointers in the right direction to rebuild your child's health, even if they've been on multiple rounds of antibiotics and their guts are absolutely just destroyed. So we're going to break down the real root cause of why your child is getting sick, how antibiotics may decrease their symptoms temporarily, and that puts like a Band-Aid fix on things, but underneath that Band-Aid can lie a slew of issues that antibiotics create, with massive side effects wreaking havoc on your gut microbiome, disrupting your child's neurotransmitters, their happy hormones, and increasing a stress response in their body, and hurting their body's nervous system function. So in my years of practice, taking many case histories, hearing about a lot of kids' gut issues, immune system challenges, ear infections, we hear about babies with colic and constipation, torticollis, latching issues, and all the way up to toddlers with frequent tantrums, sensory issues, speech delays, motor challenges, respiratory infections, emotional outbursts, teenagers with ADHD, stress and anxiety. We've heard it all. So guess what the common denominator in all of these kids' challenges is? All of them, not a single one, has not been on multiple rounds of antibiotics, sometimes even from birth, which is so stressful on the body. Now, this is a huge component of what we call in our office the perfect storm. This is also why parents deserve to be educated and empowered and understand why their kids are getting sick in the first place. Every single intervention that you or your child gets, it's our job as doctors to fully inform you of all the side effects of care, especially with medications like antibiotics, where there are major negative impacts on your child's developing immune system, where it's extremely sensitive to its environment. Now, it's really frustrating to me to know that there's huge side effects that are going on with our kids, and how that this is just being overused in our society. Like every single kid we get in our office, as soon as they're sick, their pediatrician is recommending antibiotics because that's going to get rid of their symptoms temporarily. But this can lead to chronic challenges like autoimmune and sensory issues. So this is where pediatricians and doctors are doling these out at extremely high rates. But the CDC years ago recommended a watch and wait protocol with things like ear infections and respiratory infections to wait and see if the child can get over it naturally. So here's the thing. Ear infections and congestive issues are not an issue of a lack of antibiotics by any means. They're actually an issue of three main things. So first, we have poor plumbing. We commonly see that when birth interventions occur and there's forceps and vacuum extractions and C-sections are at an all-time high in our country, this puts a ton of stress and tension in this upper neck area. This same area is where things need to move properly to get drainage out of the body. So if mucus and gunk get stuck in these eustachian tubes, in your sinuses, that child is going to have very poor plumbing and get recurrent infections and stuck fluid in their ears. And so when this tension happens, this shifts the nervous system into a state of fight or flight. So we call this the sympathetic mode in our office. So this child is going to be overreactive to a lot of things like sensory stress. Their clothes will be like overwhelming to them. They can't handle loud noises and things like that. This then creates more inflammation in the body, and then we add dairy and toxins and chemicals, gluten, food dyes, fragrances, all the things that we have in our environment nowadays, and this child's immune system is just overwhelmed, and these kids start as colicky, fussy babies that grow into children with tantrums, ADHD, picky eating, stress and anxiety. The list goes on and on. So the first thing antibiotics do is they get into the gut and they wreak havoc on the good guys, the good bacteria. And these are what creates up to 60 to 70% of our immune system function. And so we really need these good bacteria to help fight off the bad guys. So in this scenario, all of these systems are starting to shut down, dysregulate, and stress out when there's poor plumbing happening up here in the upper neck. And so this is what creates more issues. Then we introduce antibiotics, and it's double the trouble for these kiddos. So these antibiotics also disrupt the gut's ability to absorb serotonin and dopamine, which are happy neurotransmitters. And this depletes their happiness in the gut level, and then that's what's creating their stress and anxiety when they're only 6 or 7 years old and they're anxious all of a sudden. And we're questioning as adults, like, you don't have bills to pay, you don't have anything to worry about. Why are you stressed as a child? So we have to get to the root cause of why they needed these antibiotics in the first place. So we have to address that tension in their upper neck and that poor plumbing that's happening. So that's where we come in as pediatric chiropractors, and we assess this. We have 3 different scans that assess where they're holding that stress and that tension in their bodies and how we address that in our office. And so when these children are basically dealing with poor plumbing issues, they can't get the sinus, all this gunk released, we use gentle techniques to release that stress for them, restore ease in their bodies so that it can do the right thing, drain properly, regulate properly, rehabilitate that gut with happy bacteria, and function properly. And so if this sounds like a child that you know, or if this sounds like your child, my heart goes out to you, because we hear this all the time in our office. And it's really sad because we hear that these kids have been on 10 to 15, maybe even 20 rounds of antibiotics. And at that point, I'm sure you're questioning as a parent, is this really working for my child's health? So that's where we come in as pediatric trained chiropractors that specifically address the nervous system, that roots from that birth trauma, those interventions that were used at birth that put a lot of stress on that neck area. We're going to assess that area, make sure that that is really what's causing your child to get sick frequently, and we're going to help your child release that very gently. And the best thing is, common side effects of chiropractic care are your child sleeps better, they poop better, they eat better, they're no longer overwhelmed and stimulated in their environments, and their body just starts to function properly. And we see this all the time. So that if this sounds like you or a child in your family, just give us a call. Let us know if we can help, and we can answer any questions that you might have. Have a wonderful day.